Okay, we'll go ahead and get started. Good afternoon, everyone. Thank you so much for joining us today. I am thrilled to welcome you to today's webinar, Addressing Aging and Health in Rural Communities, Challenges, Opportunities, and Support. My name is Rupal Parekh. I'm an Associate Director with the New England Thriving Communities Technical Assistance Center, or New England TCTAC for short. I also serve as an assistant professor at the University of Connecticut School of Social Work. Over the next hour, we'll explore the unique challenges facing older adults in rural communities, especially here in New England, as well as the opportunities and resources available to support more equitable, age-friendly environments. Whether you're a practitioner, advocate, policymaker, or community leader, I hope you leave today feeling more equipped, more connected, and more energized to advance the work in your community. Here's a preview of today's agenda and what we'll be covering in this webinar. We will begin with an overview of New England TCTAC and its role in supporting communities facing environmental burdens. We'll then look at the aging population in New England with a focus on rural health and demographic diversity. Next, we'll explore key social determinants like economic security, healthcare access, and the related risks and protective factors. We'll then discuss how these determinants show up uniquely in New England, touching briefly on age-friendly framework. We'll wrap up with case studies and share current grant opportunities that can support community efforts. Before we dive deeper, I want to take a moment to share a little more about the Thriving Communities Technical Assistance Center program, or TCTAC, which is the foundation of today's webinar. The initiative is funded by the U.S. Environmental Protection Agency and the Department of Energy, and there are 15 regional centers, 3 national centers across the country. Each one is focused on supporting disadvantaged communities by helping them access safe, healthy, and sustainable environments. Here in New England, our TCTAC provides customized technical assistance, which simply means we work in partnership with communities to build the knowledge, skills, and resources they need to meet their environmental and health goals. Much of our work focuses on helping communities navigate complex grant systems, prepare competitive applications, and manage awarded funds effectively to ensure long-term impact. But we don't stop there. We also offer guidance on community engagement, including support with public meetings, culturally responsive communication, and tools that promote linguistic accessibility. Ultimately, our goal is to ensure that every community, not just the well-resourced ones, has the tools to meaningfully engage stakeholders, access funding, and implement environmental solutions that reflect their unique local priorities. At the New England TCTAC, which is housed at the University of Connecticut, we proudly serve EPA Region 1, which most of you know, which includes Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, Vermont, and the federally recognized tribal nations within these states. Our regional approach is rooted in equity and responsiveness. We place a particular focus on supporting urban, tribal, and rural communities, all which have been historically overburdened by the environmental, social, and economic consequences of past policies and infrastructure decisions. These communities are often among the most vulnerable to climate impacts and the least resourced when it comes to accessing environmental funding and support. I'm going to add a couple of things. Our role is to break down those barriers and offer free community-centered technical assistance to a broad and diverse range of stakeholders. So some examples of entities we serve are nonprofit and faith-based organizations, school and educational infrastructures, and individuals, of course, from underserved communities. So you can see that here on this slide. There's some more examples. When it comes to what we offer, our technical assistance is structured around three main pillars: grant preparation and submission, technical consultations, training programs, and supportive tools. I also want to highlight the core issue areas our center prioritizes. So as you can see, environmental quality, this includes water and air quality, waste and land use, energy justice, such as renewable energy access, weatherization, and clean transit, climate adaptation from infrastructure resilience to storm preparedness for vulnerable residents, and environmental health, including asthma prevention, healthy housing, and equitable transportation systems. We recognize that every community has unique needs. And even if your environmental concerns fall outside the scope of our center's direct support, we're committed to helping you connect with additional resources, partners, or referral networks that may be better suited for your goals. So no matter where you are in the process, whether you're just identifying your needs or preparing to apply for funding, we're here to help you build capacity, foster collaborations, and achieve lasting impact. Now that we've introduced who we are and the work that we do, the work that we support through NE TCTAC, we're going to shift our focus to the intersections of health and aging in our region. In the next few slides, we'll explore the demographic trends, community characteristics, and structural challenges facing older adults living in rural New England, along with the opportunities to strengthen systems of support. The context is essential for understanding how environmental and health equity efforts can be tailored to meet the needs of aging rural populations. So as you can see here, New England is home to one of the oldest populations in the country. And this trend is especially pronounced in rural areas. According to a 2019 regional policy brief, Maine, New Hampshire, Vermont hold the top 3 spots for the highest median ages in the US. The demographic shift is even more dramatic in northern rural counties of these states, where the smallest towns have significantly older populations than the rest of the region. These areas are also experiencing what we call, in some cases, a negative population growth. This means not only are these communities aging rapidly, but they're also seeing fewer younger families moving in. What this means is it limits the pipeline for the workforce in caregiver supports. In fact, aging population growth in New England is outpacing national averages. In many rural counties, more than 20 to 25% of residents are over the age of 65. And if these current trends continue, projections show that by 2030, which is obviously right around the corner, older adults will outnumber children in several rural counties. This demographic reality has major implications for health systems, transportation, economic stability, social infrastructure, and underscores the urgency of planning for aging in place, age-friendly communities, and equitable resource allocation across the region. So when we talk about rural communities, it is important to note that definitions can vary depending on the state, region, and agency. Typically, these definitions are based on population density and demographic location, often tied to census tract or county level data. In general, areas not classified as metropolitan are considered rural. Interestingly, the US Census does not provide a formal definition for rural. Instead, it defines areas as urban and everything outside of that considered rural by default. This can make classification a bit nuanced. Sorry, just lost my, for those working in community-based programs or seeking funding, it's worth checking out tools from the Health Resource and Service Administration or the Rural Health Information Hub, MI Rural tool, which helps clarify whether a location qualifies as rural for eligibility for service planning or purposes. We included links to these in the resource list at the end of today's webinar. Rural areas often share several common characteristics. They are smaller, more dispersed populations, limited public infrastructure, including fewer hospitals or clinics, greater distances to essential services, fewer transportation options, limited broadband access, contributing to the digital divide. These factors can significantly affect how older adults access care, stay connected, and remain engaged in their communities, especially places in rural New England. While rural New England is often perceived as homogeneous, the demographic landscape is becoming increasingly diverse. We're seeing growing racial, ethnic, and linguistic diversity, particularly in southern parts of New England. This shift has important implications for service delivery, as older adults may face language barriers or have cultural needs that are currently not being addressed by aging services. There's also considerable economic diversity within the older adult population. Many are living on fixed incomes or have limited retirement savings, which affect their ability to pay for transportation, housing, healthcare, and other essential services, especially in rural areas where resources are already limited or more expensive to access. In addition, disability rates tend to be higher among older adults in rural areas. This may be due to more physically demanding work histories, less access to preventative care, and environmental barriers like lack of accessible infrastructure. Combined with limited healthcare and support services, these factors can compound challenges around mobility, independence, and quality of life. Understanding this diversity is critical as we think about designing age-friendly and equitable systems of care for all rural adults in this region. As we continue, it's important to ground our conversation in the social determinants of health. These are the conditions in which people are born, live, work, and age and play a critical role in shaping health outcomes across the life course. So according to the Healthy People 2030, social determinants of health fall into 5 key categories: economic stability, like income, employment, financial security; education, access, and quality, including health literacy and lifelong learning; healthcare access and quality, such as proximity to services, insurance coverage, neighborhood and built environment, including safe housing, transportation, and walkability; social and community context, like social connection, support systems, and civic engagement. For older adults, especially in rural New England, accessibility and mobility challenges cut across all 5 of these domains. Some key issues to consider are physical accessibility of housing, public spaces, and transportation, which is limited in many rural areas. As mobility declines, many people don't think about this, but as mobility declines, fixed costs rise. For example, home modifications or in-home care become necessary. These factors don't exist in isolation. They intersect and compound risk, particularly for low-income older adults. So, for example, an older adult without a car or public transit, living far from healthcare, may experiencing worsening health simply due to barriers in the built environment. And to add to that, the impact of climate events, unreliable internet, or limited tech skills. And you can see how isolation and access issues quickly multiply. These intersecting barriers highlight, again, I keep saying it, why a place-based, equity-driven approach is so essential. Now that we've reviewed the characteristics of rural communities and social determinants of health, let's talk about how these realities uniquely impact older adults living in rural New England. So several intersecting challenges shape health and well-being for this population. So the first one you see here is healthcare access. Many rural areas in New England, particularly in northern Maine, Vermont, and parts of western Massachusetts, face a shortage of hospitals, clinics, and geriatric specialists. This is geriatric specialists throughout the country really have a shortage of geriatric specialists. So what this means is long travel distances, fewer providers, make it harder to manage chronic conditions or receive preventative care. Transportation is an issue across the country. It's particularly impactful in rural areas. So public transportation is limited or non-existent in many rural New England towns. In states like New Hampshire and rural Connecticut, older adults who can no longer drive often miss medical appointments or go without basic needs like groceries and medication, and really just because of transportation. I want to say I was a clinical social worker for 15 years before I did this work. And the number one issue I saw, I worked in Oklahoma, I worked in rural and urban areas, and the number one issue I saw for older adults was transportation disadvantage. Why they missed appointments is because they couldn't get a ride from a friend, there wasn't public transportation, and they no longer drove. Social isolation. So geographic spread, out migration of younger people, and harsh winters in New England contribute to higher rates of isolation among older adults, especially in towns where community hubs have closed or services have consolidated, right? We no longer in many towns have the neighborhood store or the centers. We have a Walmart that's maybe 10 miles away, which makes it really difficult for older adults that are transportation disadvantaged. Economic insecurity. New England's rural counties have some of the highest heating and energy costs in the country. Combined with rising housing and food prices, many older adults living on fixed income face serious trade-offs between essentials like heat, food, and medication. Digital exclusion, which I mentioned earlier. Broadband access remains uneven across rural New England. For example, parts of rural Vermont and northern Maine still lack consistent high-speed internet. This limits access to telehealth, online social platforms, and digital services that are increasingly critical for aging in place. Workforce shortage. Like much of the US, New England is seeing a shortage of caregivers, but this is particularly acute in rural regions. Fewer home health aides, direct care workers, and service providers means longer wait times and more strain on family and caregivers. Okay, let's shift now to look at solutions, specifically the age-friendly communities framework developed by the World Health Organization. The framework identifies 8 domains that support older adults in aging well and remaining engaged in their communities. The goal is to foster environments that promote aging in place, allowing older adults to live safely, independently, with dignity, no matter where they live, what their zip code is. So these domains are outdoor space and buildings, transportation, housing, social participation, respect and social inclusion, civic participation and employment, communication and information, community support, and health services. To operationalize this framework, communities often invest in what we call universal design. So ensuring spaces are usable for people of all ages and abilities. Affordable, accessible housing options, safe, well-lit streets with benches and crosswalks, intergenerational programming that fosters connection and reduces isolation, and municipal policies that prioritize aging equity in local planning. This framework is especially important in rural New England, where aging populations face unique barriers, geographic isolation, limited services, and often infrastructure not designed with older adults in mind. But we are starting to see pockets of innovation. For example, Northern Vermont has piloted small town age-friendly planning models that prioritize walkability and transportation coordination. Western Massachusetts has adopted regional age-friendly strategies that include cross-town shared services and rural transit pilots. And in Connecticut, several communities are incorporating age-friendly goals into their housing and public health planning. The Bronx Age-Friendly Report, while it's urban, also often relevant, it offers relevant takeaways. It emphasizes built environment improvements, housing first models, and partnerships between government and grassroots organizations, strategies that are just as critical in rural towns. The key message here is age-friendly isn't just about physical space. It's about creating the social and structural conditions that let older adults thrive where they are, aging in place. And for rural New England, that means listening to older adults, building in flexibility, and leveraging small-scale innovations that meet local needs. So now that we've explored what age-friendly communities are and how the framework applies, let's talk about why it matters, especially in rural New England. So implementing age-friendly principles can have far-reaching benefits. So improved quality of life. When communities invest in accessible transportation, senior-friendly housing, and opportunities for social connection, which could be in community centers, older adults are better able to maintain their independence, dignity, and daily functioning. For rural older adults who often live in areas with few services, this is really life-changing and just essential. Social inclusion. Age-friendly communities foster a sense of belonging. This is essentially important in places like rural Vermont or Western Massachusetts, where we're seeing social isolation being an issue that's impacting health and mental health outcomes. So we need to think about intergenerational programs, community events, and shared spaces that can rebuild these connections. Economic benefits. Older adults are active contributors to their communities. In fact, older adults, what we've seen in the last 5 years, or really kind of throughout, is there's a decline in volunteering among other younger populations, but there continues to be an increase in volunteering and even contributing to the work environment in ways they can. So not just as consumers, but also, like I said, as volunteers and informal caregivers in rural towns where populations are shrinking. Keeping older adults engaged in civic and economic life supports local economies and builds social capital. Health benefits. As we know, a walkable environment, access to fresh food, and proximity to care can help promote healthy aging. So what I like to say is we are all aging, so this is for all of us. These kinds of infrastructure investments also reduce emergency care costs and improve long-term outcomes. Community resilience. Perhaps most importantly, creating environments that work for people of all ages, strengthens the entire community. In places like Maine or New Hampshire, where towns are adapting to aging populations, these challenges help prepare demographic shifts and create inclusive systems that serve everyone, from children to older adults. And while these, these strategies are really, again, to benefit all families, people with disabilities, and of course, future generations. Okay, so any of these issues we have just addressed can impact older adults, as you saw in rural communities, from environmental quality and energy to climate adaptation and environmental health. These are areas supported by TCTAC and our partner organizations. Let's go on to the next slide. We're going to look at a case example from the U.S. Department of Health and Human Services, Office of Disease Prevention and Health Promotion. So this case study, this case study from Rural Health Information Hub highlights how one local leader, his name is Alberto, a co-director of Rural Public Health Department, identified and responded to a serious challenge with older adults in his community. They were frequently ending up in the emergency room with preventable illnesses like pneumonia. After exploring the Health People 2020 objectives, specifically 08, if you ever want to look it up, 06 on reducing hospital admissions for pneumonia among older adults, Alberto saw an opportunity to address these preventable health outcomes through vaccination. He used My Health Finder and NIH survey tools to better understand barriers to care and learn what many of us already know. Distance, lack of transportation, and limited local health infrastructure create serious barriers to preventative care in rural communities. This is even more acute for homebound older adults who may rely on others to bring them to appointments or may simply go without care. Older adults with disabilities who may face physical barriers such as buildings or clinics that are not accessible, or streets without sidewalks or curb cuts, and those without access to telehealth, whether due to broadband issues or digital literacy. So Alberta's solution, creating a shuttle program in partnership with local transportation department and setting up mobility vaccine clinics at the local school, offers a clear example. This offers a clear example of how targeted infrastructure changes can eliminate key barriers. But it also underscores a larger point. This community didn't initially have the systems in place to meet the basic preventable health needs of its aging population. And that's where the age-friendly communities framework became critical. This case shows how built environmental improvements like accessible local care sites and transportation are not just nice to have, they're really essential. Without age-friendly infrastructure, rural communities will continue to face gaps that put older adults at risk, not just from pneumonia, but from a cascade of preventable health issues. And finally, solutions that benefit older adults, like mobile clinics, like I said before, help everyone. In short, Alberta's story is about more than just vaccines. It's reimagining public health infrastructure through an age-friendly lens, meeting people where they are. That's what we like to say as social workers, and ensuring no one is left behind simply because of where they live or what they can physically access. So far, we've explored how transportation and healthcare access affect older adults in rural areas, especially in the context of preventative services like vaccines. Now I'd like to zoom out and encourage us to think about the broader environmental impacts that also shape health and well-being, particularly for older adults in rural communities. While we could easily spend an entire course on this topic, today I'll just offer a few examples to consider. And we've mentioned this throughout the webinar, but I'll just go over a few. Climate risks in New England. We face unique weather extremes, harsh weathers, ice storms, nor'easters. They can isolate older adults, increase fall risk, and disrupt essential services. On the flip side, increasing health waves pose serious threats to older adults, especially those with chronic conditions or without air conditioning. Aging housing stock. Many rural homes are older and not designed for aging in place. They may lack energy efficiency, accessible entries, or proper insulation, raising both cost and safety concerns, especially during seasonal extremes. Tree coverage in urban heat in places without sufficient tree canopy or cooling infrastructure, heat risk rises. Older adults, especially those living alone or on a fixed income, may be especially vulnerable during prolonged heat events. Flooding and disaster response. River and coastal towns in rural New England are increasingly vulnerable to flooding. Mobility limitations, lack of emergency planning, and insufficient local response systems can leave older adults at disproportionate risk. Energy efficient equity. During disaster or power outages, restoration priorities often favor densely populated areas. That means rural communities, especially older adults, reliant on medical devices or temperature control, may be last to regain power. This is a powerful example of how infrastructure decisions and policy can unintentionally create risk for rural older adults. I'd like to say that we at the University of Connecticut, we do have faculty that are working on energy equity and specifically this issue. Digital divide. And lastly, many rural communities still lack reliable broadband, limiting access to telehealth, emergency alerts, and connection to others during a crisis. All of these examples speak to the interplay between environmental vulnerability and social health. As we continue this conversation, I'm talking, I don't know if it's much of a conversation yet, I will invite you to reflect on what age-friendly infrastructure and disaster preparedness might look like if we put older adults in rural communities at the center of our planning. So as we discussed today, addressing the environmental and social challenges that impact older adults in rural New England requires more than awareness. It requires tools, funding, knowledge, and collaboration. That's where New England TCTAC comes in. Our center offers customized support in 3 core service areas designed to meet the needs of rural and underserved communities working on environmental health and equity. So first, grant preparation and submission. We know that many local agencies, nonprofits, and community leaders have great ideas, but face barriers when it comes to funding. Our team can connect you to funding opportunities aligned with your community's needs, support grant writing, offer proposal reviews, and help with post-award grant management, help you build competitive, clear, and equity-focused proposals so you can secure the resources needed to create impact, technical consultation. We also know environmental work can involve a lot of complex technical information. Our team can help you interpret technical documents, summarize them in plain language, and even translate them into other languages, provide data analysis and technical planning to strengthen your projects and grant applications. And most importantly, we aim to build your long-term capacity so you're empowered to engage with this type of work independently over time. Training programs and tools. Finally, we offer a variety of educational resources to grow your team's skills and confidence. This includes live training, like today's webinar, video-based modules for on-demand learning, guidance on tools like stakeholder mapping, SWOT analysis, and more, so you can take practical steps in planning and decision-making. All of these services are designed with one goal in mind, to help you build equitable, sustainable, and community-rooted environmental solutions that reflect the real needs and strengths of your population, including older adults, people with disabilities, and others historically left out of these conversations. Now I'd like to take a moment to highlight a powerful example of the kind of technical assistance work New England TCTAC provides to communities across our region. This case centers around a proposal submitted to develop a therapeutic, safe, and accessible memory garden in an affordable housing elder care setting. The project aimed to support the physical, mobility, emotional well-being, and cognitive functioning of older adults living in a memory care and independent living community. These residents, many of whom are low income and Medicaid enrolled, face unique challenges, including environmental stressors, limited access to green space, and safety risks from surrounding infrastructure. What makes this project particularly meaningful is that it was driven by a deep understanding of how environmental design intersects with aging, public health, and climate justice. The proposed garden includes features like raised garden beds, wheelchair accessible paths, and shared seating designed with input from residents themselves. Beyond the health and therapeutic benefits, this green space also will offer ecosystem services like stormwater absorption, and particularly valuable in urban settings where flooding and heat risks are increasingly due to climate change. New England TCTAC supported this effort by meeting with the organization's team, reviewing their grant proposal, and providing constructive feedback that strengthened their narrative, clarified goals, and aligned the application with EJ priorities. The proposal is currently under review. We're hopeful that it will receive funding. This is a great example of how small-scale, community-led environmental projects can make a meaningful difference in the lives of older adults, while also addressing goals like climate adaptation, community resilience, and public health equity. With the right support and strong proposal, funding can be a powerful tool for equity and innovation. So let's shift gears and talk about some grant opportunities that could help advance the work you're doing or hoping to begin in your community. As we mentioned earlier, funding is critical to building age-friendly, equitable environments. And the good news is there are a growing number of grant opportunities that align with the types of needs we've explored today. This slide lists a wide range of federal, foundation, and nonprofit funding sources, but I want to briefly highlight a few that are particularly relevant to rural communities working with older adults. So you can see here the U.S. Department of Transportation Safe Streets and Roads for All. This program supports local infrastructure improvements like sidewalks, lighting, or safer intersections, all of which improve walkability, reduce injury risk for older adults. HRSA, rural grants. These are ideal for rural health clinics, federally qualified health centers, or nonprofit organizations looking to expand services like mobile care, behavioral health, or transportation. Administration for Community Living, or ACL, funds Older American Act programs that support nutrition, caregiving, senior centers, and aging in place, especially in critical undersourced rural areas. National Institute for Environmental Health Sciences and the National Cancer Center, they support research and innovation related to the intersection of climate change, health disparities, and aging, a growing area with direct relevance to New England's environmental challenges. SAMHSA, their grants address mental health, substance use, and broader social determinants of health, especially important in regions with aging populations and limited access to behavioral health services. So as far as the foundation and private funding, we have the RRF Foundation for Aging. This is focused specifically on environmental security, housing, social connectiveness for older adults, perfect for developing local engagement initiatives. AARP Community Challenge Grants. These are small, fast action grants for things like benches, crosswalks, murals, and gathering spaces, great for building age-friendly environments on a small scale. The Robert Wood Johnson Foundation and Tufts Health Plan Foundation both have a history of funding rural equity and aging initiatives, including policy, systems change, and community leadership. John A. Hartford Foundation, their work supports the spread of age-friendly health systems and often collaborate with local organizations to advance geriatric care models. National Rural Aging Friendly Initiative offers implementation grants for rural communities to adapt the WHO age-friendly framework, helping towns plan and build environments supportive of aging populations. And also, let's not forget state and local initiatives. They're smaller scale opportunities that can help fund senior center upgrades, accessible transportation, broadband expansion, and localized planning efforts. These are often, like I said, overlooked, but they are less competitive, faster to access, whether you're working on the built environment changes, service delivery, health equity, or climate resilience. There are grants out there that support it all. This is exactly what we do with TCTAC and what we can help with, matching your goals to the right opportunities and supporting your team through the application and implementation process. So as we begin to wrap up, I want to leave you with a few resources to help you take the next step in addressing your community's environmental and aging-related priorities. First, I encourage you to visit the New England TCTAC website. There you'll find more details about the services we offer, upcoming trainings and webinars, and a Get Started form if you're interested in working with our team for technical assistance. Next, take a look at our grants page, where we've compiled a list of current funding opportunities. This includes grants from TCTAC Network, as well as federal, state, and regional programs like the New England Healthy Communities Grant. And finally, our events page is the go-to space to stay up to date on what's coming. From webinars to in-depth workshops, we're constantly adding new learning opportunities to support you in your work. All of these resources are designed to help you build capacity, connect with your peers, and move from idea to action. We're here to support you every step of the way. Thank you.